Nothing is ever perfect, and in spite of the increasingly good MRI facilities we have, there are lesions that we do not see, at least not urgently, as a DWI on an MRI, especially in the posterior territories, meaning that you might still overlook something on an MRI. And then there's this thing that you can't just say if there's no MRI, there's no problem. So there's a lot of caveats. We do use MRI in all our patients, at least those who do not have contraindications to MRI. And I feel it supports in many ways that goes far beyond seeing or not seeing a DWI, because you see what the brain tissue is like. Are there signs of small vessel disease? Are there prior infarctions? Are these silent? Do these have a pattern more like something cardioembolic, more like something large vessel disease, etc.? So it makes us much wiser on the patients, and I would be sad not to have my MRIs to look at, and I would also be sorry not to have my CTAs, because that is how you see how the vasculature is doing. But but the diagnosis of TIA is not depending on the MRI, unless you use the tissue-based, where you see that if there's a DWI, then it's an infarction, you know? So the diagnosis of cerebrovascular disease does not depend on the DWI, would be more correct way of stating it.